Now we are discussing second part of oral aspects of metabolic diseases. So the question is, beefy, red and painful tongue is characteristic of? Answer is acute nicotinic acid deficiency. Then lateral seaway disease is a disturbance of histiocytic disorder. So lateral seaway syndrome is a disturbance of, it's a histiocytic disorder. Then macrodontia is associated with pituitary gigantism. Okay, macrodontia is associated with pituitary gigantism. Red fluorescent fluid is seen in porphyria. Red fluorescent fluid is seen in porphyria. Hypogonadism, developmental delay, loss of taste and smell is due to the deficiency of zinc. Swollen joint, anemic, loose teeth and dentin dysplasia are because of the deficiency of vitamin C. Once again, swollen joint, anemic, loose teeth and dentin dysplasia are because of the deficiency of vitamin C. Next is intestinal absorption. Intestinal absorption of calcium is decreased by phytic acid. Intestinal absorption of calcium is decreased by phytic acid. Next, brown tumors are seen in hyperparathyroidism. Okay. A 65-year-old man who is anemic complains of back pain, multiple radiolucencies in panoramic view. The patient is having multiple myeloma. Once again, 65-year-old man who is anemic complains of back pain and multiple radiolucencies in the panoramic view. He is having multiple myeloma. Next, normal serum calcium level is 9 to 11 milligram percentage. Pigmentation occurs in the oral cavity and skin in all of the following except Cushing's syndrome. Okay. So in Cushing's syndrome we don't have pigmentation in the oral cavity, but the diseases in which pigmentation is there in the oral cavity are, first one, Peutz-Jeghers syndrome, second one, Addison syndrome and Albright syndrome. In all these three we have pigmentations in the oral cavity. Once again, Peutz-Jeghers syndrome, Addison syndrome and Albright syndrome. Next, hyperparathyroidism, radiological features are seen in, the answer is loss of lamina dura, osteitis fibrosa cystica, erosion below the dura mater of the skull. All of these are seen in hyperparathyroidism. They are the radiographical features: loss of lamina dura, osteitis fibrosa cystica and erosion below the dura mater of the skull. So next question is, which of the following vitamin is associated with the manifestations of the neurological problem? It is cyanocobalamin, that is vitamin B12. Okay, it is associated with the neurological problem. All of the following affects absorption of calcium. Calcium absorption is affected by citric acid, phytates and oxalates. Okay, next, a 9-year-old child has increased horizontal anterior bone loss, less cementum, and on test shows excretion of phosphoethanolamine in the urine. The child is suffering from, answer is hypophosphatasia. Which of the following may be a feature of acromegaly? Acromegaly feature is last one. We have already discussed that in the previous session. So Wernicke's encephalopathy is caused by the deficiency of thiamine. Next, hepatolenticular degeneration is seen with the deposition of copper. Hepatolenticular degeneration is seen with the deposition of copper. Next, increase in height of the mandible with increase in interdental spaces in elderly men due to hyperpituitarism. Rayleigh bodies are inclusion bodies seen in Hurler's disease within lymphocytes. Okay, so Rayleigh bodies are inclusion bodies seen in the Hurler's disease within the lymphocytes. Next is hyperpigmentation is seen in all except Cushing's syndrome. So hyperpigmentation is not seen in Cushing's syndrome and it is seen in Peutz-Jeghers syndrome, Addison's disease and Albright's syndrome. So we have one related question in this session itself, that is oral cavity pigmentation is seen. The answer was same. A histologic evidence of widespread formation of globular hypercalcified dentin and pulp horns reaching the dentino-enamel junction. Absence of laminar dura around the tooth in the radiograph are the characteristic features of vitamin D resistant rickets. Once again, histologic evidence of widespread formation of the globular hypercalcified dentin and pulp horns reaching the dentino-enamel junction and absence of laminar dura around the tooth in the radiograph. These are characteristic of vitamin D resistant rickets. Next, Addison's disease typically steroids are contraindicated. In Addison's disease, steroids are contraindicated. Next, generalized gingival inflammation, profuse salivation and scalding of the skin from the palm and foot is diagnosis. Generalized gingival inflammation is a, profuse salivation is a, and scalding of skin from the palm and foot is the diagnosis of heavy metal poisoning. Okay. Next, presence of lipid laden large foamy histiocytes in the connective tissue papillae between the epithelial retapex is a striking feature of verruciform xanthoma. Next, a 1-year-old child who is earlier normal is suffering from copious nasal discharge, coarse facial features, large tongue, bulging head and flattened nose. He is also having enlarged spleen and liver. What may be the cause? The disease is Hurler syndrome.